Using it on.
Awesome. Cool. We'll let everyone come in. Sweet. We'll give it a couple of minutes until we've got a few more joining and we can go from there.
Okay.
Welcome, everyone. Dr. Steinberg, hello, hello.
Hey, Carmen, I just texted you.
Fantastic. We'll give it another minute and then we can dive right in. Awesome. Cool. All right, let's dive right in. I'm gonna share my screen and we can go from there. Bear with me. Cool. Cool. Everyone can see? Emily, we all good from a screen share point of view from what you can see?
I can. Carmen's saying she can't see anything.
She can?
Can't.
Strange. Okay, we're very old school. Okay. Awesome. Just going to share my whole screen for the sake of time. Welcome, everyone. I'm Mehul. I work with our US team. I lead our work with medical specialists across the US. So a lot of my work is in the realm of urology and many other outpatient and inpatient specialties. Also joined by Dr. Emily Blum. She's a pediatric urologist who works with Georgia Urology, well-versed with Heidi, and she's been with us for quite some time now. I'll let her introduce herself.
Hi, everyone. I'm Dr. Emily Blum. I'm with Georgia Urology. I'm a pediatric urologist. We've been using Heidi now, me personally, for almost a year. We started out with the free version, and now we're using the paid version. Most of the peds providers are using it in some way, shape, or form. So I'm here just to share my experience, my workflow, I will tell you that our workflow at Georgia Urology is going to be drastically different than a lot of people's because we have NextGen and there is poor integration with NextGen because of NextGen, not because of Heidi. And even in that realm, we've decided to go ahead and utilize Heidi, even with the poor integration, because it's just made our lives so much easier.
Fantastic. Awesome. Cool. Quick agenda for today. So we're going to start off with kind of going through an overview of Heidi and urology, why it works so well. It is a unique specialty, and we have done a lot of things within the product to really leverage the unique nature of urology. And there's some really interesting things we're going to be running through today. We'll also go off the back of that and dive a bit deeper into how Emily and the team have been using Heidi at Georgia Urology for close to a year now for some of the providers at the location. Following that, we'll do a deep dive into Heidi as a product. We'll run a mock session, go through some basics, dive into the key features that are most relevant for you guys, and we'll wrap up with just a general Q&A. I do want to keep today's session fairly discussional, so at any point, feel free to just put your hand up, and we can, Emily or myself, whoever's not presenting at the time, can pick out some questions and unmute some folks who want to talk out and ask any questions as well. Fantastic. Before we dive in, I want to cover quickly, why does Heidi work so well in urology? It's a pretty unique specialty in that there's various work settings that our urologists are working in. You guys are a very high volume specialty. So on average, we'll typically see upwards of 35 to 40 patients a day. Now, more patients and quicker visits does not mean less documentation. I'm sure you guys know very well. So it's important to have a tool next to you that can keep up. And we'll outline a few different ways in which we're doing so with our urologists nationwide. A couple of the unique aspects to consider is because of the various work settings, surgical, office, inpatient, outpatient, the documentation requirements can vary quite a bit. So using a few features we've built into Heidi, we've got urologists using us across all of these settings. And they're able to really tailor Heidi to how they want it to function across each of their settings across the week. And across the different versions of Heidi that we can leverage as well. So to map the various aspects of urology to how we can tackle that with Heidi, the working settings that you guys are working in, a few ways we're able to address that. One is predominantly that we're setting agnostic. So there's a lot of modals in which you can access Heidi. It's made to be flexible. It's made to work regardless of where you're working and what your personal preferences are for technological use cases. We have web app, desktop app, and a mobile app. For example, a common workflow might be that maybe I'm a urologist at a hospital. I'm going between different rooms. I might use the mobile app to deal with my patients and the sessions that I'm doing back to back. But when I have a few extra minutes to go sit down at my desk, I might log in on my computer, finalize my notes and my documents there. Awesome. I might hand it over to Emily to dive in, give us a brief overview on how things have been working for her and some unique insights that she'll be able to provide, and then we'll dive into the product from there.
Yeah, and just to follow up on that, that's exactly how I use my Heidi. I usually have my Heidi on my tablet or on my phone when I'm seeing the patients, and then I go back to the computer, refresh my app, and all of a sudden I have that whole session and I edit it on the computer with a bigger screen because I hate to admit that I'm aging. I'm going to share my screen now.
Cool. Should be good to share.
So a little bit about my experience with Heidi so far. I've been using Heidi for almost a year. I sat in on a lot of the phone calls with Dax. Never tried Dax myself, but I've used the AI scribe that is integrated into NextGen, and I've used Heidi, and really the AI, I've liked Heidi and its usability, the ability to go back and forth from the transcript and the context section to the notes, and we'll go through that. A select group of the physicians at Georgia Urology were tasked with trying out different AI scribes, and this is the one that we landed on. Currently, there are around 8 to 10 people in the practice that are actively using it. And I will tell you, there was a little 3-week lapse between when we were doing our trial period and when we got everything up and running formally again. And I was so far behind in my charts in that 3-week period of time because I didn't have Heidi and I got so dependent on it. I thought I had a great workflow pre-Heidi, and then we started using it and it just threw off everything for me. And I really, anything more complex than an undescended testicle and a circumcision, I'm really using Heidi to do all that documentation. We all know, throwback for the adult urologists, when you were seeing all those bowel and bladder dysfunction patients and the girls that leaked and things like that, they're long, complex histories of which there are only usually a few important facts that you're teasing out, but they're talking for 15, 20 minutes. This is where Heidi really comes into play. And there's been more than one occasion where a patient has started telling me a history and I've stopped them. And today alone, I had a patient came into me for a hernia, and then all of a sudden it went down this rabbit hole of he was in the NICU and he had UTIs and he was on prophylactic antibiotics and he needed an ultrasound, all of this stuff. And I said, hold on, let me turn on my Scribes so I could capture all of that and really engage with the patient and pay attention to what they were talking about. There we go. So how does our workflow work? I am completely paperless. A lot of my partners, since they've transitioned to Heidi, have gone to a paperless setup. So we're not having our MAs print up all the notes and the previous notes and the records for the patients that are coming in. What they're doing is they're going into Heidi and they're opening up a new session for all the different patients in our schedule, and they're uploading all of all the information that they would otherwise have been printing out for us. Again, NextGen doesn't integrate well, and Mehul, correct me if I'm wrong. If you have a program that integrates well, it's going to pull in your schedule for you. And so you're not going to have to you're not going to have to manually populate that. So they're opening up new sessions. I have my entire schedule in there. And then what they're doing is they're going into the context section. And in sections that they need to copy paste from the EMR, we use Epic for our hospital. We're based out of CHOA. And so CHOA doesn't integrate with NextGen. So we have to go into CHOA and pull out information. We have to take the information that gets faxed over to us and put it all into Heidi. So what we do, we're pulling that information such as renal ultrasounds. We can pull in information such as our urine cultures. And this is super helpful when we have these patients that have recurrent urinary tract infections. It will actually pull in with the date and the urine culture, and will pull into the note if we ask it to the date and the colony forming units and the types of infection and the sensitivity. You can tailor all of that as you build out your notes. And so that's incredibly helpful to be able to say, yeah, they had all of these urine cultures, but only one of the 5 were actually greater than 100,000 colony forming units. The other feature, which is a relatively new feature in Heidi that I've really enjoyed using, is the attachments button. A lot of our external records get faxed to us and they're faxed over in a PDF. There's not a good way to copy over into the context section the faxed over and the PDF information. So now you can upload those PDFs. One of the other things that I will sometimes do is if I know that there's a relevant paper for a specific patient that I really want to pull in those details into the note, I'll upload that here. So for the example that I put forward, I just pulled in a patient that had vesicoureteral reflux and a urethral diverticulum, and we wanted to talk about doing deflux. So what did I do? I pulled in the reflux guidelines and I pulled in the paper written about giving deflux in the case of a urethral diverticulum. And then it's going to generate the note, which we'll go over after. So this is how we're pre-populating all of this information, either with patient information in the attachments or patient information in the context section. And then I'm going to the patient room. I'm starting the Heidi outside the room and I'm walking in and I'm introducing myself and then stating that I'm using an AI scribe that's going to listen in on the conversation. It's going to record the conversation and save it, and then it's going to generate a note. If my internet is fast enough that day, which sometimes it is, sometimes it isn't, it'll generate that note right when I'm in the room. The note is always ready to be looked at when I get back to my desktop computer for sure. And if it's ready, I'll even show the note to the patient and say, okay, do you agree? with what's going on. So that's really dependent on the speed of your office internet rather than the speed of Heidi. Heidi's ready, but sometimes if I'm just on a cellular network and things like that, it isn't fast enough. So what does a note look like? So this is kind of the typical note that I'll see generated. This is the assessment and plan. I didn't pull up the rest of it because we're going to go through that in our little mock note. But you'll see it actually pulled in the information from the context of those articles that I loaded up. So Cerwenka et al. Indicates that endoscopic injection of deflux is an excellent choice for treating vesicoureteral reflux associated with diverticula and 81% success rate. Right? So it can actually pull that information. I didn't generate any of that. I just put that paper into the note so it can pull out more robust notes. I will tell you, in my experience with Heidi, I think that Heidi has really improved my interactions with patients. I'm more engaged with the patient. It has saved me a little bit of time. It has saved me a lot of grief. And one of the things that is absolutely makes my life easier is my notes are so much better rather than being these like 4 sentence notes that really got a really basic point across. I have a more complete note that I'm proud to hand over to a consulting physician or a referring physician rather than almost being embarrassed, but at least I got the note done. So the quality of my notes has really improved. You can take a lot of time and fine tune the notes to really have the voice that you want it to have. There are some caveats to using it though. This is going to be running in the background. So this is an example of a note that was sent to me by one of our nurse practitioners. She walked into a room with the Heidi Health running in the background, and the sibling of the patient actually had a huge blowout in the diaper, and it was quite offensive in the room. And so when she closed the Heidi Health, she realized that it had generated a note for her. So it listens to everything, so you have to be a little cautious about that. And Heidi doesn't have a great sense of humor. Not yet. It doesn't appreciate that. I tend to tell jokes to my patients, and I had one patient come in the other day, and you have to edit your notes. This is just proof in the pudding that you really have to read your notes and edit the notes because their complaint was that their child's penis was hanging to the side, and they were concerned about that, and it was hanging to the left all the time. And so I reassured them that this was normal to have that happen and things. And I said, there's even a name for it in urology. And I told them the Throckmorton sign is 50% of the time the penis points in the direction of pathology. Heidi did not catch that that was a joke and put it in as part of the note itself. So thankfully I caught that as I was reading my notes. So that goes through a little bit of the words of caution that I want to throw out there to everyone. Generative AI is not perfect, so there still may be some hallucinations that you see. It's pretty rare that you do see that though, but you always need to be careful. Less so than with the hallucinations than the fact that it might not understand perfectly what was said. And so you still need to read the notes and make sure that it's as accurate as it can be. As it continues to grow and be refined, it's going to continue to be better and better. And I've noticed an improvement even in the time that I've used it. You still need to refine it and train it to have the voice that you want. And it's going to take a little bit of a time investment up front, but the Heidi team is absolutely spectacular about helping you build out those templates. So you send them out over your notes so they can kind of get a feel for what your voice is. Pick your good notes, not your shorthand notes that you're just trying to get through clinic as fast as you can with. And they're going to help you build out your templates so that you have exactly what you want as you move forward. The quality standards from the FDA standpoint aren't there. I think that Heidi does an amazing job of being responsive to the customer's needs and to really ensure that they're putting out a quality product, despite the fact that there isn't FDA oversight currently for things like this. So my thoughts on Heidi and my thoughts on just an AI scribe in general, it's not going to be for everyone. I have plenty of providers in my practice that tried it and were like, no, this isn't for me. Like I said, for NextGen, it doesn't integrate. So we have to copy paste our Heidi records into NextGen. And everyone has different ways of doing that. That's just a little too onerous for some people. Some people don't like having the scribe and having to edit it and read it. They like their own shorthand. So it's not going to be for everyone. When you're going through the studies that talk about the time saving and things like that, every experience is going to be different. the thing that really gets me for Heidi is that it's so incredibly easy to trial. It does have a little bit of a learning curve. It's not super steep, but to get the notes perfect, like I said, you have to work with the team to really fine tune it to what you want. But so don't give up too quickly with all of it. And you have to remember this is a rapidly evolving field. I've seen so many improvements within Heidi in the short period of time that I've been using it that I love. The ability to fine tune. They used to have a left brain, right brain feature that's been changed a little bit. But you can even tailor the voice that the information is coming in from bullet points to paragraph form, story form. This is a tool for you to use to connect with your patients better and to ease the burden that you have a little bit. It's not a crutch, right? So you still have to put a little bit of an effort into everything. Anyone have any questions for me about my workflow and how we utilize things at Georgia Urology?
We have two questions in the chat. So we've got one from Dr. Cavaney. How many MAs do you have, Emily?
So we usually work with one MA at a time.
Cool.
And so this work is being done before the patients get there. So as they're prepping the charts in the day or two beforehand. And what's really nice with the way Heidi is set up is it's not like once that day is set up, it's locked. If I'm working with an MA that doesn't know how to use Heidi, I do this myself. And I'll do this only when I really need it. Versus when I have an MA that knows how to use Heidi, they put the entire day in, and I'm maybe using half of the patients that they've preloaded.
Cool. Another question. How have you found the team to be helpful in terms of tailoring your templates?
Absolutely. So the team's been helpful in so many stances. I had some glitches in my system, and you send them a link to the meeting, to the session, and they'll pull out the transcript for you, regenerate it. I sat down early on and I said, "This is how I like my notes written out." They had a PEDS templated note. We sat down together with a bunch of the PEDS providers and we fine-tuned that note to a note that everyone really liked. And so we all pretty much use the same note now.
Fantastic. And another question from Dr. Paruka. Do you have a need to have Dragon to be on?
No, not at all.
Yeah.
I haven't, honestly, since I started using Heidi, I haven't turned on Dragon once. Even when I'm in Epic at the hospital, I'll use my Heidi if I'm seeing a consult or anything like that, and then I'll just plug it in. I have not used it to do surgical dictations yet, but there's nothing that would prevent me from doing that.
Correct. And we'll run through kind of up notes and stuff as well.
Yeah, I've even used it in the background when we've had office meetings and I want meeting minutes generated, and it's done a pretty good job generating just that. I don't know if Mahul wants me to say that. But it's really incredibly useful. Even just you can even pull in summaries from articles from it too.
Yeah.
Does it list billing codes and diagnosis in the assessment plan? So I have trained mine to do that. So in my template, I've said please include um, billing codes, please include ICD-10 codes, and I actually put in recommendations. Please give me recommendations when appropriate of how I might be able to upbill for this in the future. So what am I missing from a history standpoint, from a lab standpoint, so I can actually increase my billing? And so that's a little bit of a coaching thing for me.
Yep, we'll cover billing and coding as well as part of the deep dive in just a second. We actually do have a dedicated coding feature as well. So for your ICD-10 and CPT codes, we can even have Heidi offer up the relevant codes. It's up to you to include them or exclude them from the note. And then we can actually link those codes back to evidence. So if you're ever on the fence about is this or is this not relevant to today's encounter, you can click the little evidence button, which will show, and it'll take you directly to why Heidi is proposing certain codes for you. If we put the laptop in parallel to your session, can it run in the background? I'm assuming physically, yes. Yeah.
Yeah.
Typically just a phone on the table or a laptop in the room. Most laptops have pretty good microphones, so it should pick up everyone's voices quite well.
So I actually, when I'm using my iPad, I have my next gen app running and I have Heidi running in the background, listening to the conversation. And then I'm in next gen putting in my orders for the surgical request. I'm putting in my orders for any lab work or anything else that I need to do. And I'm generating my note. at the same time in parallel. And then when I get back to my computer, because it's a little obnoxious to copy and paste over from the iPad, when I get back to my computer, I'm copying, pasting the assessment and plan and the history, and then finishing the note.
Cool. Mindful of time, we'll jump into a kind of mock session. We'll continue to address the remaining questions in the chat right after. Keep them coming. These are looking really good. Cool. I'm going to share my screen. We can go from there. So this is what you guys will see when you log into Heidi for those who haven't yet explored Heidi. On the left is where you'll find a lot of your kind of quality of life settings, personal preferences. It's where we can include your snippets, which is similar to your epic dot phrases. Also where you can have your text replacements. So if you have abbreviations, or in Dr. Bloom's case, like if the pediatric patients are using verbiage that doesn't make clinical sense, as a clinical alternative, it's a great place to put in some of those. Also where you'll find your account preferences. So things like the session retention, if you want your sessions to be deleted and things like that, you can amend all those settings on the left. Just to the right of that, you guys will see our sessions list. So here you can see we can organize sessions by just the issue that was addressed, or I can actually create patient folders so that it's easy for me to navigate back to historical sessions I've run with patients and bring forward that note if I'd like to. Soon, and I'll preview this a little bit right now, soon we'll actually be able to link historical sessions into new encounters with that same patient automatically. So Heidi will actually know to automatically bring forward any historical information sitting under that patient's folder into the encounter you're having with the patient today. So the advantage there is ideally you shouldn't be having to kind of dig through the patient's record, manually bring forward that note, but instead you just tell Heidi to tick a certain section and include the relevant context from there in today's notes and documentation. Going to a fresh session, everything to do with the session itself is on the right. So obviously your start stop button, the template choose. So for today, I'm going to go into a new urology patient template. And your context tab, where, like Emily mentioned, this is where you can handle a lot of your pre-charting, including any pathology reports or historical notes and documentation relevant to today's encounter. Also a great place to be typing in any real-time observations you have on the patient that you might not want to be saying out loud. This is a great place to be putting those things as well. You can also append files as well, even things from your handwritten documentation right through to PDFs and Word docs. Heidi will auto detect even handwriting and things like that and know to include that over into your notes and your downstream documents. Fantastic. All right, let's start with a mock session, Emily, and we can go from there. Cool. So I'm gonna hit start on the top right. I can see that Heidi is now hearing both of us. Hi, Dr. Bloom. We're having a little bit of an issue with little Mike over here. He's been wetting the bed quite frequently. It's a little bit concerning right now. We're not too sure what to do.
So when you say quite frequently, what does that mean? How many days a week is he wetting the bed?
Probably at least 5 to 6 days a week currently.
Okay. And remind me again how old he is?
He's 11.
He's 11. Okay. Any family history of any bedwetting?
Yes, our older daughter also had a very similar issue. Yeah, pretty similar frequency around the same age as well.
Okay. And what have you guys tried so far for the bedwetting?
Not too
Anything?
much. Some simple things like tapering off the water a little bit earlier in the night. Seems to help sometimes, other times not so much. He's very active, so he's doing a lot of sports every night after
Yeah.
school. So um, he keeps his fluids up, and yeah, there's not too much more we can do there.
Yeah, sometimes a lot of things contribute to the bedwetting. How often, and I know it sounds really weird to ask about how often is he having bowel movements, but how often is he pooping?
I want to say 2 to 3 times a day.
2 to 3 times a day. So are they kind of hard poops, like poop balls then?
It can vary. Yeah, I think it does depend on how much activity he's doing in the day, how hydrated he is. But I would say so. Yeah.
All right. And how often is he peeing during the daytime?
I would say probably 3 to 4 times as well.
3 to 4 times a day as well. Okay. Is he drinking any caffeine?
No, maybe some tea on the rare occasion, but no, we don't give them caffeine.
Okay. Any spicy food at all?
Yeah, he actually loves spicy food. But quite honestly, we've tapered it off a little bit. We do notice that it can upset his stomach. Yeah, quite a bit sometimes.
Okay. Yeah, those are all things that I like to try to cut back on when we're managing the constipation. I'm gonna do a quick physical exam and we're gonna go over everything. So it looks like abdomen's nice and soft, no tender spots at all, pretty well appearing, bilateral descended testicles and circumcised phallus. Looks like he's around 10 or 2, so starting into that puberty phase. I'm gonna get a PVR just to check to make sure he empties his bladder all the way. But let's make sure that we're going over the basics first. I like to start very straightforward whenever we're seeing a bedwetting patient, making sure that we're peeing every 2 to 3 hours during the day, making sure that we're on some sort of constipation management because constipation is really the leading cause of all the bedwetting issues that we see. You can see it run in families, so it's not very reassuring that the sister had it up until this age. So you can expect to kind of have some bedwetting up to a similar age point. There are bedwetting alarms that you can use. Those bedwetting alarms, most people don't use them right. They try to let the kid wake up with it, but really you need to get up and wake him up with it, and then bring him to the bathroom. And that's really the best that we have. There is a medication that we can give you for bedwetting as well, but I really like to try the behavioral stuff first. Okay, so we'll get that PVR, we'll measure that out, and then we can, as long as he's emptying well, you can follow up in around 6 to 8 weeks and we can reassess how things are going. Definitely make sure that you're limiting the fluids prior to bed like you've been doing though.
Sounds good. Thanks, doctor. Cool. I'm gonna hit start. You can see that we have selected a new urology patient template. So Heidi's gonna automatically load into this. This is a custom template, so it's not going to be your standard SOAP note. I'm using it to really highlight the level of flexibility you guys do get with your documentation. And we'll run through what the back end of a template looks like and how it unlocks so many different types of documentation as well. As we scroll through, great. You can see in this template, we've deliberately paired relevant ICD-10 codes with the issues. And we've got a quick HPI summary. Maybe I've got some support staff at the clinic helping me out. I like to include a quick HPI summary at the bottom of my documentation for the handovers that we do internally as well. Fantastic. Couple of things to note. So you can change the level of detail and the general voice in which Heidi writes on the fly as well, just by clicking into this section here. If you ever want to make any changes, you can type directly into this field. It's an open text field. You can even now dictate directly into here as well. So if you want to dictate any additions or changes, you can do so if you'd like to. Going back to the other tabs, you can see that the transcript tab is now available for us to view as well. So at any point, if you do want to make sure Heidi's heard something that should be included in the note, you can make sure that Heidi's picked it up there. And finally, going back to the main note itself, I'm going to touch on the coding side of things that someone had commented about. We can click this coding button here and actually look at the list of relevant codes that Heidi has identified for us based on this clinical encounter. So if I choose to include some of these, you'll see that they get appended to the very bottom here. I can also view evidence as to why it's giving me these codes based on the clinical encounter with the patient as well. So that's alluding to our kind of coding feature. Going back to the main note, let's take a look at what a custom template looks like on the background. This is really the bread and butter of how we are going to unlock lots of different workflows for urologists. So new patients, follow-ups, op notes, and even issue-specific documentation. We can address that by the templates feature we have in Heidi. Few important things to note. In square brackets, this is what denominates the kind of information that we tell Heidi, hey, we want this information to go here in the document. But the more important thing to note here is what sits in the parentheses. Here in the parentheses, you're going to notice that we're able to communicate with Heidi like it's a person, like it's my human scribe or my shadowing resident, and tell it what I want out of different sections of my document based on my style and my personal preferences. Here you can see that I like to write the HPI section in narrative prose format. As we scroll through, I've even got instructions instructing Heidi to only include certain sections if they were mentioned. So Heidi's going to know to keep my note nice and clean as well. As we scroll further down, you can see that we're pairing each of the issues with the relevant ICD-10 code. And we've even instructed Heidi to give us a quick 2 to 3 sentence HPI summary. So when I do my handovers to my support staff, they can get caught up on the patient encounter really quickly as well. Cool. Down the very bottom, you're going to notice we have an Ask Heidi bar. This is very much like your on-the-fly assistant. You can talk to Heidi to generate documents on the fly. Maybe I might ask Heidi to write me a summary and list of discussed interventions for the parents. Random example. Heidi will generate documents on the fly. I can review this. I can open this in a new tab if I'd like to. And you'll notice that as part of any session, we can generate as many downstream documents as we might need to.
I will say for everyone that that feature has been super useful when patients are like, "Do you have any more detailed information that you can give me?" And I say, "Yeah, we'll put it in the patient note," and then pull in, can you generate detailed instructions on how to utilize Miralax, detailed instructions on how to use a bedwetting alarm, and it pulls that right in.
Fantastic. Awesome. All right, let's do a follow-up to the appointment we've just had. So here, for example, let's say that we're seeing the patient in the near future. All I have to do is hit new session. If I want to create a patient folder and have Heidi kind of organize my patient visits all together, I can do so by clicking the link button when I hover over any session. I'll give it a name. Typically, you name the session based on the patient's full name, but I'm just using bedwetting just for us to easily identify the session. And I'll also link today's session, the new session I've just created, to this patient as well. Fantastic. While this feature is not available to everyone, I do want to show it to you. I do think it's relevant for a lot of the urologists and a lot of the common workflows we see. Soon you're going to be able to tick historical sessions and actually have Heidi factor the information from those into any new visit you do as well. For today's example, I'll show you what it's like to manually bring forward those notes. So I will copy this whole note from the session that Dr. Blum and I have just completed. I will paste this in the context tab, just the whole note. I don't need to be too nitpicky about specifics and kind of use up additional mental capacity that I don't need to. Instead, I just give Heidi the whole note. I let it know that the following is the note from the last visit. And maybe I've got a follow-up template set aside, which knows how to handle additional information from historical encounters as well. So show you what this template looks like if anyone's curious. It's an identical template. The only difference is that we have an additional section here for past urological history. So Heidi's going to keep an eye out for anything seen in the context tab or discussed with the clinician itself and include that past urological history into this section here for us. Emily, let's do a follow-up based on some of the interventions and see how we go. Awesome. Hi,
Awesome.
Dr. Bloom.
Hi.
Good to see you. Yeah, we've seen some pretty substantial improvements based on some of your recommendations from last time, which is really exciting.
Awesome. So tell me about how much she's wetting the bed now.
It's honestly gone down quite a bit. I think we'll maybe see it 2 or 3 times every few weeks now. I'd say the main thing that seem to be working is really limiting water 3 hours before bedtime. So right after dinner's done, they'll have their last bit of water and he's good to go from there. We've completely eliminated spicy foods. And anything else that's been making him constipated, and that seems to be helping quite a bit as well.
Awesome.
We
I'm
haven't
telling you, the
tried the
constipation is so important.
yeah, exactly. And yeah, any other recommendations you have there, we're really open to. I think he's just really happy to be getting some full nights of sleep now as well. His energy is a lot higher. He's doing a lot better at school and in sports as well.
Awesome. It's really sticking to that time voiding schedule every 2 to 3 hours during the day. and maybe even adding a fiber supplement or some Miralax to make sure that that constipation is really under control. It sounds like it's probably going to be the final push that he's going to need, and just a little bit of time. The body still needs time to grow into everything.
Awesome. Appreciate it. Thanks very much, doctor. So I'll hit stop. Because we've picked a follow-up template here, a couple of things we're going to notice. One is not only is it going to still fill out the full comprehensive note, including the past urological history that we have supplied to Heidi in the context tab. You'll note that neither Dr. Bloom or myself talked about any of that in this session. But you can see that it is pulling that context from the context tab based on what was previously provided. Cool. We'll take a quick pause here. I'm going to quickly check the chat for any questions that have come up. Do you need to have patient consent? Great question. Yes, typically would recommend at the bare minimum getting some verbal consent. Usually when we work with organizations, we'll typically work to include consent into the organization's intake or equip the organization with consent forms that you can have at the clinic. But verbal consent for the most part is typically fine. From a HIPAA point of view, yes, we are HIPAA compliant. So goes beyond HIPAA as well. From a security point of view, we also undergo several other precautions, things like your SOC 2 and ISO 27K to ensure that all the data is safe.
Yeah, I will tell you from being in Georgia, which is a one consent state for recording of conversations, we still make it a point to ask every patient. I've had patients that have said no, they don't trust AI, they don't want the information on the AI server. And it's rare to have someone say no, but I have had patients say no.
Yeah, it's yeah, it's definitely surprisingly rare. I think often what you'll find is that the patients really don't mind when you're able to focus on them a little bit more. Especially in the field of urology, it definitely helps to not have a third person in the room as well.
From a pediatric standpoint, I can tell you absolutely, A, not having an actual scribe in the room helps. B, I found that the patients tend to be a little more engaged because they want to see what the note has actually picked up. So I found better engagement from my teenage patients because of it.
Fantastic. Dr. Cavaney is asking, when a patient asks where the data recording goes, what do we tell them? Great question. So a couple of things to note. One is we don't store any recordings. So that transcript you see created is made in real time. It's live. So we never have a reason to or need to store any kind of audio. The other thing to note is you, the clinician, have full autonomy on how long that session or data is kept. You can manually delete sessions. That destroys it off our servers. You can set it on a retention period as well. So if you wanted to automatically delete after a given amount of time, you can do so as well. Cool. Just seeing if I missed any questions. Cool. Dr. Steinberg asks, sometimes the context is overwhelming the HPI exam and assessment plan sections of his generated note. Any pointers on reducing the best, that as best as possible? Yeah. So the way we limit kind of where the context tab can populate into our template itself, we can actually just instruct the template to include or exclude information from our context tab for specific sections. So similar to how we can ask Heidi to pull from the context tab, we can actually tell it to not pull from the context tab for specific sections as well. I don't know if that answers your question, Dr. Steinberg, but it's worth giving that a shot and seeing how you go. Fantastic. Any questions I've missed? Anything you feel you need to add so far, Emily?
Not really. I feel like I've learned some stuff actually just being on here. There's so many opportunities. The one thing that we didn't touch on, and I don't know if you're planning on it, there's a lot of slang that gets used in pediatric urology. And if you can pull up your Heidi showing the section where you can actually customize. So you can actually train Heidi every time it hears this word for it puts in this. So I say poop a lot in my clinic. And when I first started using Heidi, it would bring in patient poops 3 times a day. And I put it in here, okay, every time a patient says poop, please replace it with bowel movement, right? There's people like to call foreskin meat in Georgia. And so they'll come in and ask them what they want, they're coming in for, and they say, well, the patient's got too much meat. And I'd rather not say meat in my notes and say foreskin. And they want a circumcision. So I've trained the system every time they hear that, they're going to put in foreskin.
Fantastic. And we also have snippets as well. So as mentioned, it's pretty comparable to things like your dot phrases that you have in Epic. So if you have any kind of phrases you want to expand into a paragraph of text, maybe some patient instructions or a checklist of sorts, you can do so as well. A couple of other things to note. So when you're getting started in Heidi, as you can see, a lot of the emphasis does lie in templates. This is where we're going to be able to unlock not only new patients and follow-up workflows, but also workflows when it comes to your op notes and setting specific workflows as well. So maybe I'm in the office one day, I'm doing kind of hospital rotations another. There's some different templates that can help you based on your workflow and the setting in which you're practicing as well. When you load into Heidi, you will notice that on the very left, we've got a template community. Thankfully, we work with a lot of urologists, so there is a plethora of urology-specific templates that you can explore if you'd like to as well. And how we typically work with teams is when we're working with you and your team or you and your department, when we're bringing on a whole team, we actually spend quite a bit of time with our departments and with our clinics to understand not only what your documentation looks like, but what are the workflows we can really unlock for you guys using Heidi and the templates feature. So maybe we're working with the clinic with a lot of support staff. Do we want to make some templates that are specific to the support staff or the billing encoders present at the clinic? Do we have a high volume of operations and procedures being done, or is a majority of the emphasis on new and follow-up patient volumes? All these things is what we'll spend a lot of time with you guys to kind of uncover. And when you work with the team, we'll spend a lot of time going deep into making sure the templates map onto your workflows so that you're not having to settle for the way any AI writes out of the box. Awesome. Cool. No other questions so far. We had a question from Dr. Bevan Thomas earlier. Emily, tell us more about your chart prep. Is it days before, immediately before? And yeah, how long does it take you to, or your MAs to do the chart prep within Heidi?
So it should take a few hours. You also have to remember they're looking for that information and things like that. So that's complicating the chart prep. If they have all of the information already at hand, uh, I can tell you the charts that I've prepped, if I have the PDFs, if I have the notes already readily available to copy paste, it takes me maybe 30 seconds, 40 seconds a patient to pull all of that information in. It's the actual chart prep itself that takes a long time in terms of getting that information.
Yep. Is the create note from the context feature going to be, is the create note from the context feature going to be fixed? Dr. Mittal, what specifically is the issue you've been running into with the context feature, creating a note from the context feature? And follow-up
I
question to
can,
that.
yeah, I can answer the next question from Dr. Kavani. So my clinic right now has been very fluid. I don't have an MA at the moment, so I have a rotating assortment of MAs. So I have a different person in clinic with me every day. And sometimes I'll have the same person back to back, but other times other people will jump in and help. So if I really like, I have a clinic coming up and I know the MA that's in my clinic doesn't know how to use Heidi. So I've actually asked one of the MAs to help her chart prep. So she's going to put together all the Heidi stuff. And the other MA is on the hunt to find all the records.
Interesting. All right. Don't have a timeline off the top of my head for when we'll be looking at the creating note from context feature, but I do assume if it's a known bug, should be resolved quite quickly, and we'll be sure to update you on that, Doctor. So the feature that Dr. Mthal is referring to, share my screen again, is when we're able to grab a note, in this case, any note, and when we go into Heidi, we don't have to start the session to create any documents or summaries for any provided context. We can just create notes directly from the context. I can pick a template, or I can simply ask Heidi to summarize the HPI and plan in 4 to 5 sentences, for example. And now I can create notes and documentation based on exactly what I've uploaded into the context tab. See how we go. Maybe we'll pick a urology patient template. Interesting. Mine doesn't want to behave either. Cool.
Technology still misbehaves.
Yeah, and Novi, we'll take a look into it and see what's going on. Any other questions that have popped up since? Awesome. Cool. I want to highlight, so as part of anyone who hasn't yet hopped into Heidi or is kind of on the fence, or has some other colleagues who are eager to dive in, you're more than welcome to reach out, let us know. We're happy to set up some teams on Heidi together so you guys can experience what it's like to use Heidi holistically as a team. Happy to work with you guys to build out some templates as well based on what you guys are really trying to unlock. Do you have trouble not all problems discussed in the transcript being?
So one thing that I will say is that when you're using an AI scribe, I've changed the way I talk to the patients a little bit, uh, because I want to make sure, and I'll tell them even, I'll be like, I'm doing this for the scribe. And I will do a summary. I was like, okay, to be clear, we're going to address this, this, and this. You said this, this, and this. Um, so I will speak to the patient sometimes in a way that I would otherwise dictate a note, to make sure that Heidi is capturing the things that I really want it to capture. So it has changed that interaction. I'm more cognizant of what I say.
Yeah. Perfect. Mindful of time. Got a couple more questions. Nope. Perfect. Anything you want to add on from your end, Emily, before we wrap up? I'll put our kind of contact information up if anyone does.
Yeah, just that I'm happy to help anyone and talk to anyone about any of the problems. I'm still feeling out the system. I feel like the system, there's so many opportunities that I haven't discovered yet within it. So I'm an expert, but I'm not. I always go to Mahul if I need to, and the team is readily available. But if anyone has any questions on workflow, how to make things work within your clinic, things that I've tried that have worked, that haven't, I know my MAs would be happy to talk to people. I'm happy to talk to people. Some of my partners that have been using it are happy to help. I'm really passionate about building up the Heidi community because the more users we have, the stronger the platform gets and the better it is for everyone.
Fantastic. And appreciate your time and input here, Emily. It's been super helpful.
Absolutely.
Fantastic. For those who are still here, as mentioned, feel free to reach out to myself or Emily. Our emails are up on the screen. Happy to support you guys and your colleagues. Anyone else is interested, we can get you guys set up for some trials and kind of just work to find a great point with Heidi and make sure it works for your workflows as best as possible. We'll wrap it up here. Any last questions?
Excellent. Thank you, everyone.
Awesome. Is there?
I don't think there is there?
Not officially. I'd like to get awesome. Sounds good, Carmen. Yeah, feel free to reach out to me. Email's on the screen, but I'll type it in the chat for you as well.
Dr. Jansen's one of ours. She was our COVID fellow.
Awesome. Fantastic. Well, thanks for joining, everyone. Appreciate your time. We'll also be recording this session, so this will be distributed to everyone as well shortly. Fantastic. Take care, everyone.
Thank you.